Hi, my name is Kate. I'll be your student nurse today. Can I just have your name and date of birth? Awesome. And is this a good time for an assessment? All right. And then do you need to use the bathroom at all before we get started? No? Okay. So are you in any pain? Can you rate that pain on a scale of 1 to 10? And where is it? All right, and then I do want to let you know that you are a fall risk, so just to remind you that just to make slow movements when you're getting up, and if you do feel dizzy, just please let us know, okay? All right, and then I would be getting a set of vitals, do the blood pressure, temperature, heart rate, SpO2, all of that. All right, so I want to first, for our head to toe for postpartum, I want to ask if you have any headaches or blurry vision. I'm just going to assess the IV site, make sure everything's good. And then if our patient did have hypertension, we would assess the deep tendon reflex and the clonus, but that's not applicable for today. So first I'm going to assess the breasts, and I'm just going to know if there's any tenderness, any swelling, any redness, stuff like that. And how is the breastfeeding going? Okay, do you have any concerns? Any questions about that? No. And when was the last time that you did breastfeed your baby? Or the last time the baby ate? Okay. And it is important that we are breastfeeding with a supportive bra, like a sports bra, and just so we can keep that supported and avoid direct stimulation in like warm water. All right, okay. And now we're going to assess the fundus, do a fundus check. So I'm going to put the line flat. All right. And I'm just going to lift up. All right, so I'm just going to feel, and I want to make sure that it's firm, not soft and boggy. And then I want to feel the location of it. After a few days of birth, it should be below the umbilicus, and that will just keep on dropping after a few days. All right, everything looks good. And then how have you been urinating, and any pain with urination or any concerns? No? Any like blood in your urine? All right. And then do you feel like you're emptying completely? Okay. And then I just want to ask if you're passing any gas, and when was your last bowel movement? All right. So then I would be assessing the lochia, which is just the blood from the vagina. It's pretty normal after birth to have blood. I want to let you know that more than one pad an hour would be a lot of blood, and like a clot size of a ping pong ball would also be like considerably a lot of blood. So just if you have any of those concerns, let us know. I would do this. And then have you been, how many pads have you been going through? Are you noticing any clots? Any concerns about like how much bleeding? All right, and then I would just assess that pad and make sure that it's at a moderate level. And then I would be assessing the vaginal incision. So I would have the patient go on their side and in a Sims position with knees bent. This will get a better look at the incision. But for today, I'm not going to manipulate the mannequin. But then I would look at this incision, and have you had any changes in pain? All right, and I would just like assess the degree of laceration, and if and just kind of assess the area if there's any drainage, anything looking. And you said you're not in much pain. Okay. Make sure. All right. And then, oh, also we would use a peri bottle, and have you heard of that? Okay, so that is just going to provide some soothing and comfort. It's just some distilled water that that could put up your vagina or your vagina to help soothe that perineal area. Okay. All right, and we want to make sure that you change your pad every time you do this to like decrease infection. Okay, sounds good. All right, so now I'm going to put you back up. Or I would also assess the legs and the extremities, and I would just look for any swelling bilaterally, and then are you having any pain in your calves? All right. Okay, so I'm just gonna put you up and check a few questions for you. So, how is your bonding going? Do you have a good support system? And do you have any concerns? Would you like to talk to social work at all? Okay. And then, by the way, it is normal if you do experience any like postpartum depression or like postpartum blues. Postpartum blues only lasts like a few days to a week, but depression can be a little more serious and can last like weeks to months, and this can just interfere with bonding and daily tasks. So it is important to seek help if you're going through this, and also, you know, get connected with some support networks and everything. Any questions on that? Okay, and so I'm just going to go over kind of some discharge things. Look at your discharge paperwork. Are you up to date on all your vaccines that you need? Any questions about that? Okay, and it is important to be ambulating. We want to get you up and moving after birth, I'm going to have a latch specialist, lactation specialist come talk to you, and I do want to assess your latch score. So next time you are breastfeeding, if you can just please let me know. And then do you have any questions about breastfeeding or pain management, anything like that? Okay. And then something to kind of help with pain, we use ice pack. We use ice, and we also use heat. So ice would be in the first 24 hours, and that's just going to soothe the swelling, and then we would use heat to kind of promote circulation, and that would be after 24 hours. Okay. And do you have any questions for me? When's the last time you ate? All right, do you know how to order food? Well, if you have any other questions, please let me know. Here's your call light, and I'll be here to help if you need anything.